welcome, Dr. Wekerle. It's a pleasure to have you today.
No, I'm happy to be here. Thank you for inviting me.
Dr. Wekerle is an associate professor in pediatrics and an associate member of the Alford Center for Child Studies at McMaster University. And she so happened to also be on our advisory council here at Drug Free Kids Canada. So it's a pleasure to have you.
Well, it's a pleasure to be here too. Thank you.
So I want to start with the first questions. I know that you have done a lot of work on resilience and mental health with youth. And I want to maybe talk a little bit more specifically about the current context that we're living in this pandemic. What are youth telling us? What are you hearing that youth are telling us that their particular risks are around COVID? Is there a specific risk that they're exposed to or that parents should be aware of when it comes to this kind of context when we're talking about the COVID-19 pandemic?
Right. There's a number of risks. As you might imagine, researchers got out there pretty fast to try and understand not just about the virus, but about the human implications, mental health, and with all the restrictions and changes to a young person's life, such as not going to school, switching to all online, social impact and implications of what youth have been exposed to. First of all, the idea of a pandemic. Kids get flus, they understand that they have a start, they have a finish, and they go back to completely normal functioning. That's kind of the definition of resilience, is that something happens, you're unwell or your functioning is disrupted, and then your adaptations kick in and you return to something close to normal functioning, such that you don't experience functional impairment going forward. So it's not that you feel you can't attend school or you can't see your friends, or that your mood is so very low, or that you need to seek external means for coping, like seeking or drug use or alcohol use. So the first piece is this idea, the concept of pandemic, and what the research shows that parents should be aware of and speak with their kids about is fear of contagion.
Okay.
So that's a new kind of thing that we've not had to deal with. We really haven't had to deal with fear of contagion, but it's important to speak with your children. And I always find that two strategies that work is when you disclose, you as a parent, what you think about this, how you're feeling. You make yourself vulnerable, and then the youth can respond and see that modeling and let you know what's really going on. And that communication of, I'm here to listen to you, I'm here to figure it out with you, you're not alone in this. Mm-hmm. You'll get part of your answer to your questions or support from other people, but as a caregiver, I would like to be one of those people in your circle of trust and support.
So as far as a risk is concerned, is the risk that, am I hearing right, that the risk is that the kid may feel that they're alone with this fear and they're not capable of sharing those feelings when it comes to being afraid of being exposed to the virus, and they feel isolated. So as a parent, you should volunteer an engagement and conversation in about to approach that fear and being able to talk it through. Is that correct?
Yes, and I think it might be particularly, impactful for guys if they have that view that I have to be tough. All my friends are just like laughing it off. We're doing stuff. We're doing more dangerous behaviors. The virus can't kill us. As the information has kind of rolled out medically, that young people are less seriously affected. But that kind of, let's sit down, let's talk about this pandemic thing. It's happened for a while. We have more opinions on it. Let's have a chat about it. In terms of a strategy for individuals who I say, like, I am afraid. I'm kind of afraid to go outside.
Hmm.
I'm afraid even to go in the grocery store. I don't see everyone wearing masks. Like, I don't know what to make of it, and I am afraid. It's good to look at create that dichotomy of looking possibility and probability.
So approaching your youth with um, maybe investigating if they have specific concerns about the virus, if they're afraid of getting sick themselves, and maybe exploring the possibility versus probability so that you can play together different scenarios so that maybe you can comfort them in their way
Yeah.
of viewing how they can be, how they can protect themselves against the virus.
And it kind of contextualize things I think is important, rather than get it far out of the kind of panic.
It's helpful to have an appreciation of where maybe your kid is coming from and where do we meet them and how do we support them best. So that's very useful information. And when we're talking about supporting them best, we touched on it in the first question, but I know that you do a lot of work around youth resilience. I'd like to talk a little bit more about that. If parents are looking into making sure that they're supporting their kid the best way possible and they're putting in place some strategies around building that resilience, what does that look like?
There's so many routes to resilience. It isn't one package of things. Interpersonal relating, social support, receiving social support when you want it seems to be really important, an important piece of resilience. And as that, often we might think of, well, we're feeling distressed, we want to go and talk it out with other people. Maybe that would help. Because if we sit on our own and ruminate, we know that's quite bad for our mental health. Youth are at a stage where they want to affiliate, which means they want to hang out with other people and form closer relationships, romantic relationships. This is what they're supposed to be doing in the adolescent to young adult stage. That's their job.
That's a really good point, because some parents sometimes get scared to think that, oh, I don't have as much as an influence anymore. It's all about their friends. But what I'm hearing from you, it's a normal passage of adolescence, and it should be encouraged that our kids are developing strong social networks that they can rely on.
Yeah, and we are not unimportant as parents. We're the backup to our youth doing what they're supposed to do developmentally and do some risk taking. So they do risk taking and they can come back to us to help understand and titrate how much risk, how do I understand this, that kind of thing. Mindset is also a big thing. So what we've come together in conceptualizing resilience, we've created an app called JoyPop. You can learn more about it on the youthresilience.net. So JoyPop takes some of these big categories that I mentioned, like the need to connect interpersonally, but wants to make sure it's a safe scenario. Because one of the things that the global survey of youth 2020 found that friends did help with coping with COVID, but they also had a significant increase online in unwanted contacts, unwanted content, cyberbullying. So where there's the plus, there's also some minus. And so the strategy JoyPop took was that we help you create your circle of trust. It's really important to keep the positives, the joy, the happy in the forefront, especially during a pandemic when all the news and everything's negative.
Our role as a parent to be able to support and build resilience, as we were alluding in the question, is really to be aware that it's normal for your kids to find those coping mechanisms with their social networks. That the parent is important, but as you were saying, can act as a backup and can help as well, maybe find ways of building that circle of trust and identifying who those key people can be for your kids, or at least triggering some reflection so they ask the the proper questions to identify who those trusted people could be around them.
Yeah,
Correct?
like when I talk to this person, I usually feel better.
Mm-hmm.
These kinds of simple
Mm-hmm.
things to help create a safety net. Really, it's about safety, psychological, physical safety.
Mm-hmm.
And another thing that Joy Pop does that is an important element is that it gives allows youth to express themselves um, in a way that they could share if they wanted to, but it's their own. And we, in this like journal prompts, they do journaling. There's prompts that are orienting them towards positive coping, like understanding what self-compassion is and seeing how they can apply it in their life.
Is there anything else that parents could do to approach the subject matter with their youth so that they can have a fruitful conversation?
I think one might be to talk, together about this concept of self-compassion. That is being kind towards yourself, realizing people make mistakes, and not beating yourself up, um, not being like punitive or hostile or, loathing yourself. It's about self-care and self-love. And so that fits in with having a good response to the pandemic. And we've looked at self-compassion. There's a self-compassion website. Kristen Neff as a self-compassion short form that as a family you could fill out and just understand where you are on self-compassion. Uh, that kind of mindfulness of how you show self-compassion like throughout the whole day is a practice that can be developed more.
Mm-hmm.
Do you say "I love you" to your child daily? Do you smile at your child daily? Um, you know, when they tell you something, do you say, I'd like to understand more about that? Or if they're crying, can what you're feeling is really, important. Can you put those tears into words so I can understand more? I want to help. Those kinds of things.
It may be a good opportunity for the parent to be able to self-assess their behavior towards the kid and maybe check in their own biases when it comes to substance use as
Yeah,
well.
and to understand really, like you said, the motivations for use. There can be lots of motivations.
Is there any specific risk factor that that parents should be on the lookout for during COVID or during a pandemic, or when this sense of maybe anxiety or insecurity is heightened? Is there specific things that they could look for or
Or
curious about?
I'd say it's kind of goes in two extreme outbursts. When you have this outburst over something that is way out of proportion to what the actual thing is. I usually say things like, I'm really sorry you're upset. It must feel bad for you in your body to feel these upset feelings. If you're ready to talk, I'm ready to listen. If you want to give it a bit and come back to it, we can go for a walk and chat, you
Mm-hmm.
know.
Mm-hmm. Okay, so it's a matter of looking at the specific behavior and maybe being able to see if it's not very common for that kid to react a certain way, and then maybe able to see if there's any discrepancy in behavior. Because when you're talking about outbursts and being able to relate it to that specific event, or if there's something else behind it. So I guess it goes back to the why that we were talking about. If the kid is saying I'm using, going back to the why, but going back to I can see that this is making you upset. Why is this making you so upset? Right? So
Yeah.
going beyond that behavior.
And not just coming at why, but coming at with that compassion to others, that loving kindness, which I see that this is uncomfortable for you, and I'm sorry for that. I see that, you're, it doesn't seem like you, want to do more than watch TikTok. I'm not sure that feels good across the whole day. You know, can we talk about this a bit? You know, what is the best thing you've seen on TikTok, right? Because it's always something there. And then, do you ever think like, I have any other ideas about it? Like, I should get up and do something else. You know, like,
Mhm.
um, and what would that be? So it's kind of that, what would be decisional balancing, looking at the pros and cons, because if somebody's using something repeatedly, it's reinforcing to them.
Mhm.
It may not be apparent why. It may reinforce a negative self view, but we don't. But if it's repeated, it's doing something for that person.
So, Dr. Wekerle, thank you so much for your time today. Do you have any
Pleasure.
parting words for us to help parents best support their kids when it comes to this time during this pandemic, and really being there to support their kids when it comes to substance use as well?
Yeah, I think it's important to realize resilience is in our natures. It's part of how we adapt, and has, since we've been here on earth, we've been adapting. And so the pandemic is another thing we need to adapt to. And it's an opportunity for us to reflect on our stylistic ways of adaptation. And if we have reached for substances to date, this is an opportunity for us to look at, what else might we do? You know, how is that serving you? What other resilience skills could I do? As I mentioned, Joy Pop, there's journaling, there's a safe social contact, there's also an art draw, there's a Tetris-like game that helps you focus, and to allow youth to ask the question, how is this helping me? How is this substance use helping me? And what could I be doing instead with the time? And investing in yourself and your self-compassion is always an excellent strategy going future forward.
Well, these are very wise words. Thank you so much. Thank you for your time today.
Thank you. All the best, and bye-bye to everybody in Zoom land.